Dr. Ordon opens up about contracting coronavirus.
I was in the perfect place to catch coronavirus.
From the illness,
it started with a headache, then it progressed
to his recovery and what it really means when you have antibodies. You would just have this ability to fight it off. Is there any part of that that is liberating?
It's not licensed to let my guard down.
That's today. Hey everyone, it's Dr. Travis Stork, and as you can see, I'm still here in Nashville. And if you listened to yesterday's show or my podcast this week, you'll know that Dr. Brad Spellberg and I talked a lot about this group of individuals who have been infected with the coronavirus, but did not know it or were unsure. And lo and behold, I recently found out that our very own Dr. Ordon has been infected. And I don't know the full story here. So I thought, what better time to catch up with Dr. Ordon than via this technology where I can talk to him safely from Nashville. He's currently in Beverly Hills. So I think Dr. Ordon today will all give us a unique look into this sort of retrospective look. And here's the God's honest truth. I was with Drew. I was with Dr. Ordon back when I think he may have been having symptoms. I don't know, but I'm about to find out.
Good morning, Doctor. How are you?
I'm fine.
I miss you, Doc. That hair's getting long and you've got a little bedhead going on there. You got that med school long hair going on.
I'm going to see how long I can take this. But hey, without further ado, Dr. Ordon.
Yes, sir.
You look great. You look great.
Thank you. And I feel great.
But walk me through the last couple of months, because since the pandemic started, I obviously haven't seen you. We last were spending time together right around when this was starting to get out of hand. But you found out that you had coronavirus. So give me the story, because I don't know the details.
I just found out last week, and that was based on an antibody test that I got in the desert. And I think that you have my results there. I went to a local lab. They did it right there. It's a simple pin prick. You wait 15 minutes, you get the result. But we'll get back to that. Let's backtrack. So end of January, I had been in Dubai a couple weeks before that. Then I went to Seattle, which, as we know, was a real hotbed. I went for a TED Talk for this EPIC conference. So it was in Seattle, really up close and personal with a lot of people, shaking hands, hugging, airplane. People weren't wearing masks because this was really before the storm hit. So I was in the perfect place to catch coronavirus. So actually, I felt it on the plane coming over me, as we all have felt when you feel the flu coming on. And that's exactly how I felt.
But you, at this point in time, weren't thinking COVID-19, because in your mind, this was an illness that was still far overseas.
Exactly right, Travis. At that point, yes, they were talking about it in Wuhan. It had not hit Europe yet. I had been in the Middle East. It wasn't a big deal there yet. So it started with a headache, general malaise. I had a runny nose. I had a sore throat. I was achy. That's what I felt initially. And then it progressed to fever, chills. The night sweats were pretty brutal. And then finally, the kicker, the symptom that really made me think was a unique, novel cough that I've never experienced. That it wasn't low in the lungs. It was sort of mid in the respiratory tract, but deep and sort of tight. And I kept saying, I told Dr. Chopra, I told my wife, I said, I bet I had it, because what I went through was so unique.
And it's why this virus is so tricky. Thinking back, remembering that time, everyone kept saying, well, we don't think it's going to come to the US. Now, in retrospect, it was likely already here and we just didn't know it. And obviously, I'm thinking back to the last time we saw each other. So you had already recovered.
I sure had. And, as I got the test, and you know how that immunology works. And I think you have a copy of this, but this is the important graph to look at, that when I got tested, my IgMs, immunoglobulin M's, had dissipated. So in other words, it's telling me that my infectious process had been at least a month before, but my IgGs were up, which, speak to the fact that I was infected previously. So, what's the take home here for people listening? We don't know exactly how the immunity is going to work with this virus. I mean, because I tested positive, I'm listening extra closely to the experts. Will I have a long-lasting immunity or a short-lasting immunity? They think that you will have immunity based on the way other coronaviruses have responded, particularly SARS.
And for people to understand immunity, once you have circulating antibodies, it doesn't mean that the virus can't enter into your moist mucous membranes. The reality is you would just have this ability to fight it off, which I have to ask you, is there any part of that is liberating? That feels oh my gosh, everyone else out there is worried about getting it.
Well, it did validate, because as a doctor and as a patient, I mean, as things start to open up, I'm not going to let my guard down.
I have to tell everyone watching right now that Drew has a virtual background. Yes. That is why. So Drew has a virtual background.
I know. I told myself not to use my hands, but I can't stop myself. But Travis, if I can just say again, what made me think, well, I'm over 65, and, I was in that risk group. I had been traveling. I had been in a crowded setting, unprotected. So, I mean, those are the keys. Those are the things that we put the brakes on to try to control this pandemic.
Let me ask you this question. How did you go about getting the test, and how were you able to even find out where it's available? Because I think that's part of the problem right now.
I heard through the medical community in the desert in Rancho Mirage, where I practice. So I found out that way, but I just heard on the LA news today that there will be antibody testing that will be more available. So you just need to go online and check the resources in your area.
And that's a great point. And Drew, mainly, I'm just happy that you're doing well. We know that not everyone is having a good outcome. And that is what is so scary about this virus. But at the same time, it is reassuring to see you looking good, feeling good.
And I attribute a good outcome into that. I listen to what we preach on the doctors, taking good care of yourself. And if you do have any other underlying medical conditions, you try to keep those at bay. And of course, lifestyle boosts that immune system. I think that's one of the reasons my wife didn't get it. We did try to isolate ourselves, but boosting that immune system, I had to do it.
Is that arugula?
Arugula. You have to eat right, boost that immune system with those great antioxidants and berries and things like that. But, practice what you preach.
It's so true. Paris has been making this incredible Greek salad, just loaded with vegetables, and it's incredible. And then in the morning, we're waking up and making these frozen blueberry smoothies, getting those antioxidants up. But more than anything, Drew, I hope we see each other in person sooner rather than later when it's safe to do so.
Likewise. All the best to the family and the baby in the oven.
You and Robin and the kids. We'll hopefully see you soon, bud.
But again, it's not time to stop saying, stay safe.
No truer words could be said.
See you.
Bye, buddy.
Bye.
Coming up, gaming supplements with dangerous amounts of caffeine are being marketed towards kids and sold to them online without any restrictions. Are these drinks an innocent energy booster, or are they putting kids at risk? Then, 5-year-old Celeste was brushing her teeth when disaster struck. She had fallen forward and the toothbrush impaled the back of her throat. That's coming up. A new type of energy drink marketed to video gamers has made its way into markets and has concerned parents asking, what's the real deal? Check it out. Gaming supplements with dangerous amounts of caffeine are being marketed towards kids and sold to them online without any restrictions. They claim to help kids focus while playing video games and keep them alert and awake longer. The supplements come in powdered form, allowing kids to add as much as they want to any beverage. Are these drinks an innocent energy booster, or are they putting kids at risk? We're now joined by parenting expert and author of the book, Get the Behavior You Want Without Being the Parent You Hate, Dr. Deborah Gilboa, via Skype.
Dr. G, how are you?
Hello.
Hey, everybody. It's great to see you again.
So I'm sitting here looking at the back of one of these powdered formulas, and it has these caricatures. It says fitness, sport, work, study, party. How dangerous are these drinks given that they're marketed to essentially kids?
The biggest concern is the caffeine. The caffeine that is 150 milligrams for 12 ounces. So less than a can of Coke, and the amount of caffeine if your 12-year-old drank a 6-pack of Coke or 2.5 Red Bulls or 3 espressos.
And that's if they put the proper portion into the mix, because a lot of these are powders, right?
Directions exactly, right?
So, I mean, there's nothing to stop a kid from adding in a few extra scoops.
Correct.
And then who knows, you're getting 500 milligrams of caffeine. What is the risk there with kids?
There are a few problems here, and one of them, like we've talked about with vaping, this is sweet. So unlike if a kid takes a sip of coffee and they're inhibited because it's got a bitter taste, these kids are disinhibited because it's sweet. They're disinhibited because it's marketed by their favorite YouTubers, talking about how they're using it to improve their gaming scores or how long they can play or their focus or attention, which are things adults are telling kids they should be better at: focus and attention and performance. But the biggest problem here for sure is that caffeine is additive. It has long-term effects, as you guys know, like stunting your growth, and it changes brain architecture, but it has really immediate effects: raising blood pressure, raising heart rate, destroying sleep architecture, making kids really irritable, and disinhibiting some of their impulse control. So I think the first thing is to find out if they're even using it, because it's not really possible for a middle schooler or even a high schooler to use this safely. So if they're using it at all—
And there's no age restriction, right? Like you can just go online and buy this, correct?
Absolutely. And they're marketed similarly to sports drinks, but they're really different. Sports drinks don't have caffeine.
How do these compare to your standard energy drinks that we've become so familiar with, which are also marketed very heavily, I believe, to younger generations? Do you feel like this is riskier because it's powdered form and you can, quite frankly, quickly overdose because of that? Or is it really in the same genre of concern?
It's in the same genre of drink because it works in the exact same way. It's a little savvier for 2 reasons. They're saying what it doesn't have. It's gluten-free, it's sugar-free, it's got vitamins or antioxidants, talking about the things that people might have heard associated with healthy drinks and foods. The other problem is a lot of the YouTubers who are talking about this don't know why it's a problem themselves. They also may be too young or not educated about these issues. And there are so many examples of 12-year-olds reaching out to their favorite YouTuber on Twitter or on Instagram to say, hey, my parents won't let me get this. Will you tell me where I can get free samples? Or will you help me tell them that it's fine? And you can see from some of the responses, the YouTubers also don't understand why this might be dangerous for them or for their followers.
I mean, Dr. G, right on. I mean, people don't realize caffeine is a potent drug. It is a drug. You can overdose on caffeine, and especially in younger kids, as you alluded to. If you have an underlying heart condition, you get all jacked up, you can create big-time problems. So, I mean, you have to monitor this just like you would other drugs.
And incidentally, if I may, there are other stimulants in these products beyond just caffeine. Yes, and so you're talking about multiple acting stimulants, very easy to overdose. This perception that, oh my gosh, this is healthy. Not only is it healthy, perception-wise, but it's gonna help you be a better gamer. May even help you do better in school. I'm gonna do this just because I'm intrigued. Yeah, it's very sweet and it tastes like candy.
Yeah.
It tastes like candy. So I'm a kid, I'm thinking this is good for me, it's gonna give me energy. So before we go, Dr. G, these things on YouTube, these ads, it's really hard to prevent your kids from seeing them. What do you do?
And it's better not to prevent them from seeing them. It's better to teach them to be a savvy consumer. So ask before you tell. Any middle schooler or high school wants to tell you what they know rather than hear what you know. So ask if they've seen these, ask if their YouTubers are advertising this, ask if they think it's a reasonable choice, if they have any concerns, and then dive in with them into the ingredients and show them the equivalencies. But when it comes down to it, if you're seeing any change in your child's behavior that concerns you, their sleep is worse, they're more irritable, their appetite has changed, they're complaining of stomach aches, headaches, nausea, then you've got to look a little closer and you've got to lay down the boundary that no matter how much you want to improve your performance in any way, taking a medicine or a pill or a supplement to do that is not the right path.
Your message is always so true, and it's communication with your kids. If you're not communicating with your kids, others will be, and your message is always so sound and true. Thanks, Dr. G.
Thank you, Dr. G.
More to come. Coming up, 5-year-old Celeste was brushing her teeth when disaster struck. She had fallen forward and the toothbrush impaled the back of her throat. Then, dental therapists are a new level of care in the dental profession that aims to increase the access to care in underserved communities, but some say that it will only end up giving patients inferior care and that things could easily go wrong. That's coming up. Getting your kids to brush their teeth can be difficult, and getting them to sit still is sometimes even more difficult, but these two challenges combined can be a recipe for pure disaster. 5-year-old Celeste was brushing her teeth when disaster struck. Her father said he usually makes her sit still while brushing her teeth, but this time Celeste was bouncing up and down. Her father told her to stop, but when he turned to talk to his wife, he heard Celeste scream. She had fallen forward and the toothbrush impaled the back of her throat. She was rushed to the hospital where doctors performed an emergency surgery, saying she was lucky the toothbrush did not sever a blood vessel. Celeste is now recovering and back to her happy self, but this serves as a cautionary tale to parents to ensure their kids are being careful when brushing their teeth. And precisely because of this, the American Academy of Pediatrics Dentistry tells parents, don't let your kids, especially under the age of 7, brush their teeth without being supervised, because Drew, you're an ENT by training. These things can and do happen.
Yeah, your kid, when they're bouncing around, I mean, they shouldn't have anything in any of their cavities on the head and neck. Kids bouncing around with a Q-tip in their ear, kids doing something with their finger in their nose and bouncing around, and of course, anything to do with the throat. If they're using a spoon, a fork, a knife, a toothbrush, and they're bouncing around, they fall, they can impale their throat like this child did, impaled her soft palate, which necessitated closure of that mucosal laceration. She's going to do fine, though.
So functional, she'll be okay.
Oh, yeah. I mean, that's a soft palate injury, and they probably put a stitch through the muscle and through the mucosa. We know how well the oral cavity heals. When you have your tonsils out or your wisdom teeth out, that heals really quickly and well.
Boy, that gets real close to the carotid artery back there.
But it was blunt. I mean, the chances...
Luckily, yes, it was blunt.
But a sharp object, if it had been a fork or something like that, which can happen too.
That does happen, yes.
Then right there in that anatomic site, she could have gotten her carotid, yes.
Well, what is another household item that might end up causing a problem for parents? How about this? Confetti. So a 9-month-old girl needed surgery after swallowing confetti that was shaped like a star, and no one really knew what was going on. This confetti was lodged in her throat for 11 days before doctors realized that this is what was causing the symptoms. The child had been brought into the hospital a couple times, coughing up blood, developing a fever. doctor sent her home. They didn't know what was going on because, in fairness, a kid comes in with those symptoms. You're not thinking, well, they probably swallowed confetti and it's lodged somewhere and forming an abscess. You know, luckily doctors were able to get at this with surgery and remove it. But the most important thing when you start talking about a kid who has an issue and it's not resolving, maybe it's a cough, difficulty swallowing, difficulty eating.
Exactly.
The history. Is there some history where maybe your child swallowed confetti, a button battery,
or any foreign
a coin,
right? Like a coin, a button, a battery. I think we're seeing a lot of this now. And if they do keep saying that they're having trouble swallowing or they're complaining of persistent
Breathing,
pain
in this case,
or
in
breathing,
the lungs.
Yeah.
I mean, she presented with coughing, so it was lodged in the airway somewhere, and that star sitting there was a nidus, formed a big abscess. I saw the X-ray. I mean, that was big-time abscess.
That,
which they
you
had
know,
to
when
drain.
that bacteria spreads, that can make a child septic. I mean, they can get very, very sick from this type of abscess. So, good thing they finally figured it out.
Again, watch those kids. They love swallowing things. I don't
swallowing them, put them in their nose, put them in their ears. You've seen it all. I know that, and I've seen it all too.
You've seen it in the ER.
Yeah, but I haven't seen. I'm with Drew. I have not seen confetti.
I think it's so hard. I mean, when my kids were little, I'm sure, Drew, you feel the same way. It is just so hard to always supervise them and be on top of them with all of these things. Just try your best to be vigilant.
Keep those batteries.
Yeah, keep those things out of reach.
Coins.
Well, that's why everyone's tendency is to be a helicopter parent, because when you start having to worry about confetti causing sepsis and abscesses, boy, oh boy, let's take a break. Coming up, dental therapists are a new level of care in the dental profession that aims to increase the access to care in underserved communities, but some say that it will only end up giving patients inferior care and that things could easily go wrong. Then,
this gel claims that it has instant results. Its claim is that it moisturizes, it depuffs, it addresses dark circles. It's meant to work right away.
That's coming up. More than 56 million Americans live in areas with a shortage of dental health providers. Some states are now creating a new tier of dentistry called dental therapists in order to try to bridge this gap. Dental therapists are a new level of care in the dental profession that aims to increase the access to care in underserved communities, such as rural and low-income areas, where there are fewer dentists because the communities are less profitable. Dental therapists can perform routine procedures such as temporary crowns and even extractions. Proponents say that dental therapists are expanding care into communities that need it most. But some, including the American Dental Association, say that it will only end up giving patients inferior care and that things could easily go wrong. Are dental therapists the solution to the country's lack of oral health care, or are they just a way to give poor care to those at risk? We have dentists Dr. Cheyenne Warren and Dr. David Rice both joining us currently via Skype. Thank you both so much for being here to talk about an important topic. Now, we've talked a lot recently on this show about certain areas and their lack of medical providers and mid-level providers in medicine. Now we're talking about it in dentistry. I want to start with you, Dr. Rice. You say there's a downside to this concept of having dental therapists. Tell us why.
These are patients with big problems. They have complex needs. And we're talking about serious procedures being performed by people who are seriously undertrained. And that brings, serious risks to the table. If you think of it this way, you have a 16, maybe 17-year-old son or daughter, and they just get their driver's license, and you have the ability to give them the keys to a car that drives over 1,000 miles an hour. Is that something you would do? And my guess is the answer is no, because there's risk. There's lots of risk. So that's what we're doing when we hand a dental drill or we hand the forceps to somebody who can take a tooth out who doesn't have a lot of training. There are nerves that can be damaged. There are blood vessels that we could introduce anesthetic into, and there are complications and drug interactions that I really feel like we need the most highly trained professional to be administering that care.
Is there a clear definition of the scope
of a dental therapist. I have no experience with a dental therapist. I've seen a dental hygienist.
Let's ask Dr. Warren, because you're developing a curriculum.
Maybe you could share with us the scope of practice of a dental therapist so we have a better idea of what they should be practicing and how we can best train them.
Yeah, so the scope of practice can vary by legislation state to state. However, it's commonly through CODA, they can do all fillings on primary children's teeth as well as adult teeth. They can do stainless steel crowns on children's teeth and root canals on children's teeth. It's not the same as an adult tooth. They can do, like Dr. Rice said, all extractions for primary or baby teeth, and some extractions for adult teeth that would be considered class 3 mobile with severe periodontal disease. And a lot of preventative procedures that we do every day.
And what level of training then do they need for this? And how closely do they work with, say, a supervising dentist?
So dental therapists have been practicing in the United States safely for the past 15 years. But only a few years ago, CODA, the Commission on Dental Accreditation that accredits all dental schools, dental hygiene programs, dental education, came out with their set of standards. It's 3 years, it's extensive. The procedures that they do, I know, are more time than I was able to spend in dental school on the same procedures.
And I would go back to you, Dr. Rice, because in all fairness, we're talking about, use the analogy of the car going 1,000 miles an hour, but if we're talking about areas where people are potentially going with no dental care at all, I understand your reticence, but it also harkens back, I think, in the medical field. 20 years ago, a lot of doctors were really resistant to the increase in mid-level providers, and I'm talking about nurse practitioners, physicians' assistants, and of course, we now know they're ubiquitous in medicine, and people have strong feelings about that, one way or the other. My question for you is, yes, you would always love to have the best trained person taking care of you each and every day, but the reality is we know there are underserved communities in this country, and also there are certain procedures where if you've done them enough times and been trained well, you can be effective at them. So how do we address, if we do not allow dental therapists, how do we address these communities where, quite frankly, they're not getting any dental care?
First, I would say the data that we have so far on dental therapists is, although we think they're going to underserved areas, in many, many instances, and I'm going to use Minnesota as an example, they're one of the longest standing states to have this. There are about 100 dental therapists, and only 9 are actually in documented underserved areas. So we're not bringing much more volume of dental care to this underserved area already. We know that. And to me, the simplest solution is, I've been teaching dental students and young dentists for 25 years. So what I know is that population, they have massive student debt, and they're looking for areas to be trained better. So to me, the simplest solution is you marry people who have a strong desire to relieve their debt. They're highly trained, and we connect them with underserved areas of this country. We incentivize the most highly trained people to go and practice in those areas. And then we bring together this group of people who really need help and a group of people who really want to help and need the ability to relieve their student debt, which is insane today.
And before we go, Dr. Warren, you're someone who, obviously you're a dentist and you feel quite a bit differently. Could you lay out the future that you would envision, your ideal future, where everyone is served appropriately?
Yeah, we have 57 million Americans that are going without dental care. And I agree, we need many approaches. Dental therapy is just such an opportunity to do that. It's just also, simple math. Dental therapists, just like hygienists, now free up dentist time to do more procedures. Once dentists didn't want dental hygienists either. Now I would say they can't possibly live without 2 or 3 of them. I foresee a future where that will be the same for dental therapy, and what a great thing that will be for the Americans that go without dental care right now.
And I would just add, as we close here, I never knew when I went into emergency medicine how much dental care would play a role in the emergency department. And I mentioned earlier medicine versus dental care, and the truth is they coincide. You can have a dental infection that can lead to life-threatening complications. So I urge everyone out there not to neglect their dental health. We know that good oral hygiene, proper dental cleanings, proper dental care can have not only effects on your oral and dental health, but your overall health. And so that's why it's so important that everyone has good dental care. Dr. Warren, Dr. Rice, thanks so much for sharing your opinions on the show today. And it's interesting, as we go to break, it is just so interesting where we're at in this country in terms of some areas, quite frankly, are overserved. We have too many doctors, too many dentists. Other areas, we don't have any. And these are difficult problems that we have yet to solve. We have to start solving them. Stick around. Coming up.
This gel claims that it has instant results. Its claim is that it moisturizes, it depuffs, it addresses dark circles. It's meant to work right away.
Then
the hospice team can actually be a family that comes in and spends time with somebody who's really been alone for a long time. And it's amazing to see that some people actually graduate from hospice.
That's coming up. Does a gel that promises to eliminate under-eye bags, dark circles, and wrinkles with instant results, does that sound too good to be true?
I want it.
One such product makes this claim, so Dr. Batra is currently in our backstage room putting it to the test. Dr. B, what's going on?
Yes, so thank you. So I have 3 amazing testers here who all suffer from puffiness, dark circles, fine lines. I have Jackie, Ellie, and Vivian, and they are going to put the brandless depuffing eye gel to the test. So ladies, I'd love for you to take the tubes, and I'd just like you to apply it now. So this gel claims that it has instant results. Its claim is that it moisturizes, it depuffs, it addresses dark circles, and its claim to fame is that it has 4 active ingredients. It has probiotics that are meant to balance the microbiome on your skin. So Travis, definitely in your wheelhouse there. There's pomegranate, which moisturizes as well as stimulates collagen. And then 2 really interesting ingredients. It has green tea, which has ECGC, a polyphenol that's a very potent anti-inflammatory that's meant to decrease puffiness. And caffeine, which we also know constricts blood vessels, constricts lymphatics, is meant to decrease puffiness. So I'm gonna have you ladies just kind of rub that in. And the interesting thing about this gel is it's meant to work right away. So first and foremost, we're gonna do the before and after. So let's take a look. So the photo we're looking at is Jackie before. So we're gonna take a peek at that. And now we're gonna aim the camera and look at Jackie live. Let's see the after. So I will say that it's definitely looking less puffy, which makes you look more rested. And compared with the before, where there was a little bit of shadowing, it does seem to be a little bit better. It's a little brighter looking. So we're gonna move on to you, Ellie. First, we're gonna look at your picture. So this is Ellie before. And so you can see some shadowing there. You can definitely see a little bit of puffiness under the eye. And now we're gonna look straight at Ellie. This is the after in real time. And so obviously the lighting is different, but I would say that there looks like there is less puffiness. And then Vivian, of course, we're gonna look at you. This is your photo before. And so Vivian, I think for you, there's a little bit more pigment and discoloration there. That's creating some of the dark circles, but I do see some of the fullness and the puffiness as well. And then this is Vivian in real time afterwards. And so we're gonna look straight on. And so, Vivian, I think for you too, I think the primary benefit here was a sort of depuffing effect, which is probably that green tea and that caffeine aspect. Jackie, what do you think of it?
It feels great, and I think maybe not looking 1 minute after, maybe 2 minutes after putting it on, it makes a big difference.
Okay, well, thank you. Ellie, what do you think?
Yeah, I find it really, I feel like my skin's tightening, and I feel more awake, and yeah, I love it.
Terrific. What do you think of it?
Well, I try a lot of beauty products as a beauty influencer, so it's really rare that I try on a product and actually like it right away. And I actually feel like my dark circles are a little less prominent. I don't know about the bags being as depuffed as I would like, but it's definitely less dark under my eyes, so I appreciate that.
Perfect.
So Dr. Batra, I mean, we trust your opinion. We have patients coming in every day with these complaints of puffiness, brown spots, lines. So what is your final word on this?
My final word on this is looks like a well-formulated product. The active ingredients all have reasonable science behind them. But do remember that a good product is never going to replace a doctor's consultation. So if you do have true pigmentation, you have true vascular change, this isn't necessarily going to give you a long-term fix. But it definitely is going to, as a short-term fix, boost your confidence, add some brightness. It's a very reasonable price point at $11. So I think that, in my opinion, it actually delivered what it said it was going to do for a skincare product.
Dr. Botcher, grab me a tube.
Will do.
Ladies, thanks so much. Dr. Botcher, thank you. Let's take a break. Coming up.
The hospice team can actually be a family that comes in and spends time with somebody who's really been alone for a long time. And it's amazing to see that some people actually graduate from hospice.
Then, what drink may actually cut your risk of liver cancer in half? That's in today's Doctor's Prescription. That's coming up. Benjamin Franklin famously said that nothing is certain except death and taxes. I can't help you feel better about taxes, but hospice nurse Derek Flores says there is a way we can all feel a little bit better about how we approach death. It's the subject of his book, 7 Keys to a Peaceful Passing. And Derek, I'm so glad you're here. Can you explain to us what inspired you to write this book in the first place?
Hospice can be such a mystery to people. They don't know what to expect. Death can be very frightening for people. So I wanted to give them a resource to empower them to make decisions that would ensure a peaceful passing.
And you mentioned death, and I feel like in our society, in any society, people have trouble talking about it. And when you don't talk about something, obviously it's going to be even scarier, and people don't understand all their options. I love that as a hospice nurse, you really do a great job of dispelling some of the biggest myths out there.
There's so much hope in hospice. Hospice is all about relationships. It's about opportunities to make things right that were wrong during your life. To have that prodigal son experience with somebody coming home to be with a parent who's passing away that they haven't talked to for decades maybe. That's one of the most amazing things about hospice.
But it's also, and this is when the research came out on this, I think it's important to note that it's not a death sentence. A lot of people feel like if they look into hospice, they're giving up. And hospice is so different than that in the sense that it's not a death sentence. And the data would support the theory that in some ways it could be the opposite of that. Explain that to us, will you?
You know, so many of our patients are elderly, and so many patients, unfortunately, at that age, don't have many visitors. So the hospice team can actually be a family that comes in and spends time with somebody who's really been alone for a long time. And it's amazing to see that some people actually graduate from hospice. They end up living much longer lives. It's really amazing.
What is I believe on average it's 29 days, correct? So people actually statistically do live longer if they go into hospice, which is so fascinating.
You're right. Sometimes it's a real practical reason because doctors and nurses are working together. They're able to manage symptoms a little differently, make adjustments to medications. But I think it's the human touch between people, being able to be with somebody else and talk about their life, review their life.
And I think also managing pain and giving them dignity and control over their passing, I think that must make such a huge difference.
It really does. Pain is something that hospice nurses and doctors working together, they're experts at. So nothing better than having a couple of people focusing on that symptom.
When we all trained, there was a line between the mind and the body. We now know that there is a seamless transition between the mind and the body. The connection is profound. When you start reading the data where someone chooses to go into hospice, they, on average, are going to live 29 days longer than if they didn't. That is shocking to all of us, especially us doctors who are taught to, the only thing that treats is prescriptions and treatments. But the treatment that you all offer to me is just so profound and wonderful and understated. And I highly encourage people out there to read Derek's book, to read about it, because the one thing is we are all at some point in our lives going to be faced personally with these types of decisions or with our loved ones. And you can't make a good decision without making an informed decision. And I applaud you because you're helping people do just that.
Thank you.
What drink may actually cut your risk of liver cancer in half?
I don't know, but I think I smell the aroma.
Smells good.
I heard one person say it. Coffee! Yes, a study from Queen's University Belfast found that people who drank coffee were actually 50% less likely to get the most common type of liver cancer. And it tracked nearly 500,000 people over 7.5 years. They found that those who drank coffee 50% less likely to get diagnosed with hepatocellular carcinoma, and that accounts for 90% of liver cancers. And we've known for a while that coffee is loaded with antioxidants.
Cheers. Caffeine, magnesium, riboflavin. I'm so happy to have coffee on this list.
And I love it because the more we're learning about coffee, potentially cutting risk for cancer. Maybe
cutting risk of type 2 diabetes, cutting risk of Parkinson's.
Where do you think these coffee beans are from?
Are you a coffee aficionado? Can you type beans? Like Colombian.
I think it's Colombian.
Yeah.
You know what these
Mexican?
coffee beans are? Tasty.
Yes. All right. Cheers to that.
Cheers.
Thank you, guys.
Thanks for tuning in. If you missed anything, head over to doctorstv.com. Thanks so much.